Welcome to Hustle and Pro Season 2, talking sports in Frisco from youth to pro. Now here's your host, Kelly Walker.
Welcome to this episode of Hustle and Pro. So today I felt a little bit of sports pain from some of the sports that I've been playing this summer and trying to nurse an ankle injury that you've probably heard me talk about. So we're going to talk about that today. We have Andre and April Patterson here to talk with us. Hi guys, how are y'all?
Doing good.
Hi.
How about yourself?
Wonderful.
I'm great. It's Friday.
Yes.
All right. So first I want to know a little bit about your connection to sports. And let's see, who would you say is your favorite athlete?
Oh man. This might be controversial these days, but one of my favorite athletes is LeBron James.
He's awesome. Yes, controversial. Sure. Sure, but yeah, that's a good common answer. So then, what are your favorite sports?
So I'd say basketball is by far probably my favorite. We're a martial artist family. So of course, I love the ground and pound, UFC, right? These days we're so busy we don't get a chance to watch as much, but I tend to watch the highlights.
So when you say you're a martial arts family, did you participate when you were younger in that, or is that something like your
participate
children?
now?
Currently, yeah, we're all Taekwondo black belts, except for the 3-year-old. Not yet.
Are you serious?
Yeah, and hopefully we'll be testing for our second Dan soon.
Wow, out of the blue. I would have never thought. I mean,
we clean up well.
Well,
We're always hurt, though. No.
Taekwondo just isn't my top of mind, like, mainstream guess of what's happening in sports because it's not my lane. But that's awesome. It's fascinating to me. Man, we need another episode on Taekwondo. Okay, we'll do that next time.
Sure.
So one more quick hit too. So then, I bet I can guess this. What's your favorite sports movie?
Oh man,
You're gonna say Karate Kid, aren't you?
Well, actually, now that you say that, I've been watching Cobra Kai a lot lately. So I don't know if it's my favorite sports movie. It's a classic. But right now, Cobra Kai has been awesome. It's been a continuation of the story, and I think it's been great. So it's awesome. Yeah,
okay, I love it. All right, so tell me, in addition to that, that background, what is your background? What's your story? And that'll lead us also into talking about pain and kind of pain management today.
Sure. No, basically, I grew up in the area. I grew up in the Dallas area, of course, just like many people in Texas. I played football, right? So that was kind of my intro to sports. My wife, on the other hand, is much more ingrained in sports.
Yeah, I've played sports since the age of 4 or 5.
What sports?
Softball, and then in middle school I added volleyball and basketball. Actually, I'm sorry, I played basketball since I was 5 as well. So volleyball, basketball, softball, and then I power lift in my senior year of high school. And now I'm a martial artist because I like torturing my body.
Okay, that's awesome. You had me at softball and basketball and volleyball, those sports, but I cannot say the powerlifting part. So that's awesome.
I only did it for a year, but I got pretty far in when I competed in high school.
I bet you learned a ton about that.
I did, and I love the way it made me feel. In some way, I love the way that I felt strong, but it was kind of rough on the body. It was the first time where I started to really feel like the aches and pains when you don't know proper maintenance, when you're lifting like that, you got to take care of yourself.
Yeah, it seems like it would be rough on the body. One of those.
On the knees.
Yeah.
On the knees, for sure. Yeah,
for sure. So then fast forward to now, adult life, and we're here in Frisco, and I know you guys are small business owners.
We are.
So tell me about that journey.
Yeah, so as a family, we've been entrepreneurial as long as I can remember. It started with my mother, right? So my mother owned our own marketing and advertising business for 25 years. What actually brought her to Frisco was she opened up a math and reading learning center 15 years ago. And so, we all participated in that. We opened up one in Austin where my wife ran that one. And then we, got into all sorts of different businesses. And one of those we got introduced to the health and wellness side of the house with red light therapy.
Yeah.
And, we had a close friend of ours that was a huge pain sufferer. She was dealing with a chronic illness. And she exposed us to it because a friend of hers was being propositioned by a company to endorse it. Actually, he's a local professional athlete.
Oh.
And she had, she was very close friends with his wife. She got exposed to the red light bed and completely changed her life. And that's how we got exposed to that.
Okay, I've heard some of these stories about this type of, I don't know if the word's treatment or
Modality.
therapy. Modality.
Yeah. Yep.
Okay, I didn't even know that word. And I've personally experienced it and heard about it. And then most recently, just in the last few years, with different injuries, playing softball and all the different things I do, and my husband does, playing soccer, we get hurt a lot. And as we get older, we're recovering slower and maybe not recovering, and it's definitely changed, recovery times for us.
Sure.
So that's how you and I know each other is this red light therapy bed, right?
Right.
But the technical term for it is photobiomodulation.
That's right.
Did I say that right?
You got it spot on.
Okay. PBM?
PBM or PBMT. Yeah.
PBM. All right, so you can articulate that better than me. That is your business. So what is
Yes.
photobiomodulation?
So actually, photobiomodulation is the technical term that they're using today, but it's a technology that's actually been around for 50 years. It's gone by different names in the past. Cold laser therapy, low-level laser or low-level light therapy is also other terms for it, or simply red light therapy. And quite simply what they found is that light within a certain frequency actually, instead of damaging our cells, serves as a catalyst to our cells to heal themselves, right? And so not to get too geeky with it, but what they realized is when our cells are exposed to certain frequencies, in particular 600 to 880 nanometers, right? That's the range that we're talking about. ATP, right? So the energy source of our cells goes way up. Oxidative stress, which is the damaging aspects of aging, so to speak, goes way down, and so then our cells are able to heal themselves. And so what that means is inflammation goes way down, pain goes way down, and once those aspects or those conditions goes way down, now the cells have the ability to really perform the way they were designed to perform.
Like
right?
repair and replenish, and
That's exactly
to
right.
get back to the way they should be.
That's right.
performing.
That's right. That's exactly right.
So you mentioned this isn't new. Like, it's newish to people like me, but so it's kind of a mainstream thing, right? Like in Canada and the UK.
Internationally, it's very popular. I remember when we were starting to do our research. Again, I hadn't heard of it. I went to PubMed.gov, which is the National Institute of Health's website, typed in photobiomodulation, and found thousands of white papers. And so I knew friends, around the world. I started just throwing it out there and say, "Have you heard of red light therapy?" And they would laugh at me and they would say, "Yeah, we've been doing this a really long time. Don't know why it's taking you guys so long to find out."
Where have you been, right?
Right, exactly. So apparently we like our pills here in America, is what they would say.
Well, yeah. I mean,
Yeah.
unfortunately, that is a major problem
Yeah.
in
Absolutely.
our kind of culture of sports and just injuries and going to the doctor, going
Absolutely.
to the ER. You oftentimes leave with a prescription, and that might not fix your problem. It masks your problem.
That's exactly
And then
right.
you might be reliant on opioids or whatever it is that sort of masked that problem that you didn't get to the root of.
Yeah.
But I've also heard that red light therapy can also heal wounds and regenerate kind of skin issues and things like that. So I don't know, give me kind of a laundry list. Like, why do so many people use this?
Yeah, you actually bring up a great point, Kelly. The application is far-ranging because remember, this is impacting you at the cellular level, right? And so once the mitochondria is revved up, you got the energy revved up, and the damage that's happening against your cells with oxidative stress goes way down. The applications are widespread now. So some of the things that people use it for on the skin level are things like increased collagen or reduction of scarring, right? Because now these cells are optimal, right? And so now they're healing and repairing the way they're designed to repair.
That's amazing.
Yeah, and so that also means that people that are suffering from, say, chronic illnesses, like autoimmune disorders, and that result in a lot of inflammation. Inflammation is a natural byproduct, right? It's a part of the process or the disease process of cells. Well, it's also painful, right? And it also causes a lot of other challenges. Well, if you're able to reduce that and reduce the cells being attacked, they're able to do what they were designed to do, right? And so we have people coming to us to obviously reduce pain. That's in the name of our business.
Like back pain? Is that
Back
a big
pain,
one?
All kinds of pain.
knee pain is another one that people come to us often.
Yeah.
Right, like torn meniscus or
Like too much powerlifting in high school.
Yeah, that's right. Frozen
Yes.
shoulder is another one.
Oh, yeah. I was just literally this morning talking to a friend she said, I have frozen shoulder now.
Yes.
I didn't know that term until today. It's funny you say that.
It's across the board. It definitely is across the board as far as anything having to do with joints, edema, or having to do with tissue, like tissue damage, torn muscles. Especially elite athletes are definitely leveraging. I know the Olympians made it a big deal in 2016 for their sprinters because what they used to say is, recovery from, say, a hamstring pull would take a week and a half, if not longer, right? And so those are all the different examples of how it was being applied. Now, you're also seeing it being applied from a TBI perspective, so traumatic brain injuries, concussions,
Oh, really?
cognitive. I chuckle because these days, I don't know if you've been seeing these laser helmets or laser hats for regrowing hair. Like Bosley has one.
Well, I've heard of that, but I don't specifically know that application of it.
Yeah, and so the reason why I chuckle is because that was a byproduct of them using the helmet to address TBIs. When they were doing their analysis and their case studies on using red light therapy, right, to address traumatic brain injuries, they noticed that hair was being regrown. So now they're like, oh, we should market this as a product.
Why
You
not?
see the hair helmets all the time.
Yeah.
That's cool.
And they do work. They definitely work,
Well,
but that
yeah.
wasn't the initial reason for
Can
it.
you give your personal testimony about your dad? Can we?
Sure, go for it if you want to do it.
Well, you did now.
Well, his father has been bald for over 20-something years, probably
Oh, yeah,
longer.
30 years.
30
plus, yeah.
years, and his hair just doesn't grow. But he gets in the bed often, and he noticed a little stubble starting to come back. And
He noticed he had to start shaving
Started
again because
shaving
he
again.
was getting
Yeah.
fuzzies everywhere.
I love hearing those personal stories and connections. April, what about you? What made you interested in this as a part of the family business?
Well, one of the ways I was really sold into finding more holistic ways of healing was because I suffer from a condition called VCD, which is vocal cord dysfunction. And some of the symptoms are just hoarseness, always coughing, and always when I have flare-ups, it feels like I'm having asthma attacks, only my oxygen levels are great. So I would go to doctors and, of course, get misdiagnosed, and I've gotten pills and steroids and all kinds of things thrown at me, asthma pumps, and nothing was happening. So I just started realizing that there were just more, I started investigating more holistic ways of just treating myself. And one of the ways I did that was changing my diet, taking dairy out, and then light therapy, just finding things that I can treat my body well enough for it to heal itself.
Yeah, letting your body do the natural work.
Right. And it
inside.
was so much better than pills and, steroids or whatever was getting thrown at me. It was wonderful. I haven't really had a flare-up since we've changed my way of living.
I love that. That's great. So we have talked about not only that, then skin issues and hair regrowth and scalp, traumatic brain injury, knee, back pain. I have an ankle injury, and I have had red light therapy done on my ankle specifically with like a handheld item, and I've also laid in the therapy bed. So I'm curious what you guys are seeing and if that's common that you use both kinds of applications of red light therapy and for which kinds of injuries are best.
Very common. As a matter of fact, one of our most popular packages is a combo package where we have clients that want to do both the bed as well as the probe. So yes, the probe is targeted, but it's concentrated, which means that one treatment from the probe is like 4 trips to the bed, right?
Oh, okay.
But it's for a specific area, right? And so people will come to us to address like an ankle or a knee or, shoulder, neck. But of course they want the treatment for the whole body, right? For the universal effects, just for their body as a whole. And so the probe is actually probably one of the oldest form factors of red light. So people that have been exposed to it in the medical field in particular, or in the health and wellness, chiropractors. Mm-hmm. So a lot of them are starting to use red light as a part of an additional modality as far as a part of their services. Believe it or not, some of the biggest believers of red light therapy, especially when you're talking about the probe, are veterinarians. Yep. When I went to the training for red light therapy, when Dr. James Carroll, who's very famous in the industry, came to give his training, there was maybe 100 of us there. I'd say 70 of them there were vets.
Wow.
And they weren't there to be convinced. They knew it worked. They were there to be trained on the technology, because from their perspective, with animals, there's no placebo effect. Right? Either it works or it doesn't. Right? And they were convinced time and time again, this works. Right? And so that's where a lot of the probes were being used. You're also starting to see it used in dentistry as well as orthodontics as well. I know there was one practice here in the DFW area. I wish I had his name at hand, but he has a whole laundry list of studies where they were using mouth guards that were doing red light therapy for 5 minutes, where it was significantly speeding up braces, right? How long you had to have them on. And so he would have like initial prognosis of 17 months down to 5 months.
Wow.
Or, 20 months down to, 8 months. And laundry, you just keep scrolling, and there was just study after study after study where all these clients
so
were doing
many different ways to use it. I didn't know many of those.
Absolutely, yeah.
So you talked about like a combo package, and we talked about the probe and the light. So I just kind of want people to understand like what we're even talking about. So
Sure.
First of all, we're talking about your business, which is Xscape Pain, and that's with an X.
That's
and if
right.
you're listening to this, it'll be on the podcast. You can check it out, but we'll also tell you how. But so when you walk into somewhere like Xscape Pain, you get a choice if you want to do that full bed experience or the probe experience. So
That's right.
I know maybe this isn't how you tell everybody, but like the bed looks and kind of feels like a tanning bed.
It looks just like a tanning
Okay,
bed.
for people like me who, I hate to admit it, but used to lay in tanning beds when I was like young and didn't know that you're not supposed to.
All
do
the other
that.
damage that goes with it. Yeah.
Yeah, so it's kind of nice laying in there. As a busy mom, it's like a treat
It's a reprieve.
to lay in a quiet, warm room by myself with no distractions. It's like a day at the spa. But it's also nice laying there knowing this is not damaging. This is not giving me skin cancer. This is all good. That low light level, giving you all the benefits. And so you lay there and it's actually like, you feel better. And you kind of leave with like a sense of like a renewed energy, right? Because you just sort of got this little burst of energy. So what's the typical length of minutes that you're in the bed?
15 minutes. So 15 minutes is what we, settled on. Maximum is 20 minutes, but everyone is good to go at 15. I will say when you look online, it ranges, right, from 8 to 12 minutes sometimes is what they'll call out. But we feel like 15 minutes, everyone walks away feeling really, really good. Yeah.
So I mentioned that it kind of looks like a tanning bed, right?
Yeah.
So my experience was my first time laying in that bed. I didn't know what to expect, but Sierra works there, and she gave me the rundown. But what's cool is that like she gave me the instructions and set me up, and everything is sanitized and wiped and cleaned and ready to go. There are some optional like eye coverings if you want to use them, but she also explained that you don't have to, which is awesome, knowing that, oh my gosh, if that rolls off or falls off, I'm not going to go blind if I open my eyes.
Right.
You can even look at your phone if you want, right? All that stuff. But she gives you the rundown. She even helped me get a fan going on me so that I wasn't leaving there gross and sweaty, that kind of thing.
Sure.
But she even sets the timer and turns it on.
Yeah.
So it's like I don't even have to worry about messing it up. You just hop in, and she goes back to the front desk and does it all remotely from there.
It turns on by itself and turns off by itself.
Yeah, that was cool. I like that. Because that's the kind of stuff that stresses me out. I don't want to be laying there thinking, oh my God, have I been in here 30 minutes already? What's happening?
Did I push a button? Do I not? Am I cooking?
Yeah. Did I set this wrong? What did she say about that? So I that's the weird things that go through my mind. But yeah, Sierra and Serene.
Yep, Serene is our other employee as well. They're both phenomenal. We get great reviews from everyone. They're very sweet. At the end of the day, what we really care about is making sure people feel good, right? I mean, yes, we know the long-term effects are awesome, but in reality, like you just stated, I mean, we really focused on addressing the everyday person. Yes, people that are elite athletes benefit greatly, and we have a few of them that come. But in reality, we have people from all sorts of walks of life come, right?
Normal people
Yep.
that feel normal pain every day, like we do.
Absolutely.
So I'm curious. You mentioned like elite athletes and everyday people. I'm curious, like, what can you kind of give us some examples of like success stories that you've
Yeah.
seen? I mean, I know you told us about your father, right? But
Yeah.
like, I don't know, what are some of the other examples? I'm always fascinated by hearing what was wrong with somebody on day one, and then how did they come out of it, and like how did it help them?
Well, we have a number of success stories. I'll keep it within the context of athletics. So we do have elite athletes that are, power lifters, like like my wife had mentioned, on a whole nother level. I'll give you one in particular. This woman, definitely, she's the type that lives in the gym. You call them a gym rat.
Yeah,
right?
yeah.
She's definitely a gym rat. And she had so much pain in her shoulders that she was having to sleep in the bed for 2 years with her arms on pillows because she couldn't let her arms go down.
Couldn't like relax.
No, not at all. And of course, the prognosis was she had to get surgery, but she didn't want to do surgery because she couldn't work out.
Well,
That was her.
I mean, nobody wants to have downtime. If you're
Right.
if you're active, that's hard.
Absolutely. She was getting 12 saline shots in her left shoulder, 14 saline shots in her right shoulder every month. She did cupping. She did all sorts of modalities to try to alleviate the pain. We did one treatment from the probe. One treatment, she was without pain for 4 days.
From one treatment.
One treatment
Wow.
for 4 days, right? Now, to put that in context, even when she would get the saline shots, it would take her pain level from a 9 to like maybe a 4 or 5. With this, she probably had pain alleviation. This is from her lips, going from a 9 down to a 3 to 2 that night.
Wow.
And then the next night down to 1-0.
Wow.
Yes.
So, I mean, that goes back to the whole notion of like this red light therapy,
Yes.
photobiomodulation,
Yes.
right? Isn't just a pain relief band-aid. It's actually a healer, right?
That's
so
right.
it actually repairs some of these damaged cells.
That's a great call out. And the other thing is there are no known side effects. So it is a great, I mean, they've actually had a lot of studies recently where, oral mucositis is a common byproduct for cancer patients, right? And so oral mucositis is where their body stops producing mucus, but that ends in ulcers and sores.
Yes,
And
yes, uh-huh.
That's why a lot of them you'll see,
Yep.
dried lips, and depending on what treatment they're getting, some of them they're 100% guaranteed to get oral mucositis. Well, they were using red light therapy to heal those wounds, right? Not just reduce the pain, because obviously the pain was one thing, but you would have these sores that would stay open. Diabetic ulcers is another one where they would not close up. I'd like to reiterate this. It's not the red light that actually does the healing, right? It's your body that's doing it.
Oh, okay.
All the red light's doing is a catalyst, right? So turning your body on to do what it was designed to do to begin with. So that's the cool thing about it is, again, they can't explain why our bodies react this way. They just know that this happens. They just know that this is the phenomenon that our cells react to these frequencies of light, right? And they can get really technical when explaining that, but then you're saying, but why?
You already lost me at the 600 to 800 nanometers.
I do want to say that we oftentimes say red light, but it's actually two frequencies, and that's why I mentioned the 600 and 800 nanometers. It's red light, which is the visible part. That's why you always see the red,
Okay.
right? But it's also near infrared, which is the 800 nanometer, which is invisible.
Oh.
And the reason why I mention that is this is different than infrared sauna, right? So when people say, like I know a lot of med spas
Yep.
have infrared saunas.
Yep, I've sat in those before.
Yep. And so those get a little higher in the frequency where that's actually in reference to far infrared. That's when you start generating heat. So that's why the term cold laser was being applied to this a lot, right? So it's cold laser because it's not heat generating. It's right on the cusp where, it's on that light frequency where it's not, generating that heat. And so there's benefits to infrared saunas. It's just very different than what we're doing.
And that second type of laser you talked about, it doesn't damage you. Because somebody like me is like, is that the kind you can't see? That's scary. Like, are we back to the UV and all that stuff, the dangerous stuff? So we
Right.
know, this has been around long enough where we know it's safe.
It is very safe, yeah. There's very, very few contraindications that are related to near infrared, right? Again, device matters, how it's applied matters, where it applies matters as well. But at the end of the day, the areas that we like to stay away from are if you're pregnant, we won't let you get in the light bed. It's not because there's, potential damage. It's just there's no studies been done on that. And no one wants to take that risk of putting a pregnant woman there. However, using the probe on pregnant women is great for specific areas.
Sure.
We just like to stay away from the fetus.
Yeah.
Right? So ankles, swollen ankles, right? Damaged shoulders or backs are hurting. Probes are great for that, right?
Cool.
And so that's one. And the other one is we like to stay away from injection sites from steroids, right? So anything that has a potential adverse effect or result from increased circulation, that's really where we like to make sure we're cautious.
Okay, that's fascinating. All of the different uses or applications and ways that you've seen your clients at Xscape Pain heal.
Yes,
it's so cool. And how long have you guys been there?
So I guess it's coming up on 2 years.
Okay.
Yeah, we were officially supposed to have our ribbon cutting in March. Unfortunately, this pandemic related to COVID
life changed in
kicked
March.
us in the teeth.
Yeah, but you're open. You're up.
Yep.
You're fully open, up and
Fully
running,
open.
and I mentioned it's one of those places that you make your reservation, you book, you're online, and you go in, and there's one typically like a singular person helping you, getting you into your own private room. You're in and out.
That's right.
15, 20 minutes. It's a pretty easy thing to happen or to go through and experience even right now when things are not at full speed, right?
That's right. The only thing we changed really once we reopened up is the hours. So before we were open up a little bit longer. Now it's just Monday through Saturday, 9 to 2. We also have an oxygen bar. So that brings in a different group where we have some people that literally all are about they pop in, hey, I need to go and get a fix real quick on this oxygen bar and get out.
There was someone doing that when I was in there last week, and I said, how is it? And she said, oh, it's great. Try this one, So I will
They have
try
different
that.
flavors.
Yeah.
We basically, it's a combination of oxygen and aromatherapy.
Yeah.
Right? And so it's aromatherapy, infused oxygen, and people come in and depending on what they're looking for. So those that I know there's big proponents of essential oils, and that's what we use, right? And so, depending on what you're addressing, we had some people that come to us that are suffering from allergies or a headache. Others, they're looking just for a pleasant, relaxing scent. And so when we combine that with red light therapy, so again, one of the byproducts of red light therapy is increased circulation. So we have people that do the red light bed, and then they'll go to the oxygen bar. So now their blood is flowing, and they've got oxygenated blood that's flowing even better, right?
Wow, okay.
And so, that's why we kind of combine the
Good
two.
layering on each other. Okay, so then tell people who haven't been there yet to Xscape Pain where they can find you physically and find out more about you online.
Sure. We're at the northeast corner of Main and Teal. I know everyone feels ashamed when I use this as a reference, but if you know where Hertz Donuts is,
oh yeah,
you can see us as soon as you walk out our door. Hertz Donuts is to the right.
Yep.
So it's they're great, and so that's where we're located. As far as online, you can go to www.xscapepain.com. So that, again, that's Xscape pain.com. We're on all the social media platforms as Xscape Pain, so you can always find us there. You can call us. You can text our business line at area code 972-528-7033. But the easiest way, I always tell people, if you're interested in a free light bed session, right, or free light therapy session, is text "Light Me Up" to that phone number.
Light me up.
Yep, light me up. No spaces. Just say "Light me up."
To the 972 number? What was it?
972 528-7033.
Awesome. I'll put that in the show notes for everybody listening too, if you guys want to go back and check it out. Yep. Well, Andre and April, thank you guys so much for popping in the studio today and teaching me a little bit about learning a new big word, photobiomodulation.
Yeah. Oh, see, you got that really
It's
good.
like I can roll it off the tongue.
Rolls off the tongue.
I got it now that we've talked about it for 20 minutes.
Right.
Awesome. Well, thanks, Andre. Have a good rest of your Friday.
Sure, you too. Thank you.
And thank you for listening to Hustle and Pro. Subscribe on iTunes, Spotify, or wherever you listen to your podcasts, and we will see you next week.